I want to give light to this lady's story about her mother and her cancer diagnosis because she was told to not do certain therapies by a doctor who's actually a doctor of physical therapy, which is not a physician, but is using the term as doctor. So I just want to highlight this story for y'all.
Dear Dr. Lake, my mom is alive today because she didn't listen to you. She got a mammogram, they found the cancer before it took everything, and because they did, she's still here. Still a mom because of a mammogram. Still waking up to her own life because of a mammogram.
I talk about this all the time. This fear of mammograms is unprecedented, and I get it. You're getting a lot of information about how horrible mammograms are for your health, but they do find early cancers and they do save lives.
Don't get to question that if you've never sat in the waiting room before. So I'm going to debunk your claims one by one because no woman should have to bury her future just because she believed your fear instead of the facts. So let's be clear. While I appreciate your position as a functional medicine doctor, the American Cancer Society and the U.S. Preventative Service Task Force and decades of peer-reviewed research said something very different. And
again, functional medicine doctor, they use that all the time. This is a doctor of physical therapy. This is somebody that did a doctorate in helping your muscles and your bones and your ligaments and your tendons. This is not a physician. So whenever you see functional medicine doctor, find out what kind of doctor they are.
the breast surgeon who I watch save lives every week, those patients are here too because of a mammogram. So when it comes to life or death decisions, I'll go with the data, not the cherry picking. So you're right, mammograms do use radiation, but it's tiny. Each one gives about the same dose as just a few months of natural background radiation. Even after 35 years of screening, the total exposure is still less than 10 years of just living on Earth. And the risk of that causing cancer? Very, very small. One major study found that it might cause 1 to 2 deaths per 100,000 women, but prevent over 1,100. That's why the U.S. Preventative Service Task Force and the American Cancer Society still recommend it, because mammograms save lives. The benefits far outweigh the risks. Now,
this is a common myth, but it is true that the number of lives saved is significant enough that 1 in 100,000 women may develop breast cancer from the mammograms, but we're saving all these lives. So it's a populational thing. And I understand y'all have your individual decisions, but these decisions are being made on the entire population, not just one person.
this is another common myth, but it's just not true. Needle biopsies are safe. They're how we diagnose cancer, and they're done millions of times each year.
The myth that doing a biopsy spreads the cancer is completely false. And then the question would be, how the hell do we know what it is if we don't biopsy it? So indeed, biopsies are safe.
The risk of cancer cells spreading from a biopsy? Extremely rare, less than 1% in large studies. And in breast cancer specifically, there's no evidence that a biopsy increases spread or worsens survival. Doctors take strict precautions. They even use separate tools for different areas of the body to avoid cross-contamination. If biopsies actually cause cancer to spread, we wouldn't be using them to save lives every day.
Also, if biopsies cause cancers to spread and we really biopsy all the time to find the cancer, then we would see stage 4 cancers all the time, which just simply isn't true.
What's far more dangerous is not doing the biopsy. Now, some early tumors may have a capsule, but the cancer doesn't stay put. Even if it looks contained, malignant cells can already be spreading through the blood or lymph. So the idea that you're safe if you leave it alone? False. Studies show that disturbing a tumor through biopsy or surgery does not make it spread. In fact, catching it and removing it early is what improves survival. Doctors also take out the area around the tumor and the biopsy path, so any loose cells are gone. But leaving a cancer untouched in hopes it won't grow, that's not protection, that's a missed chance to cure it. But here's the truth. 1 in 8 women in the U.S. will be diagnosed with breast cancer in her lifetime. In 2025 alone, an estimated 316,950 women and 2,800 men will be diagnosed with invasive breast cancer. Now your videos, hundreds of thousands of views, tens of thousands of likes. So do the math. If just 100,000 people watch, that's 12,000 women statistically at risk. 1 out of every 8. That's not just a number, that was my mom. That's someone's mother. And even if 1 woman skips her mammogram because of your video, that's not caution, that's causality.
This is misinformation causing death. This is misinformation and, in my opinion, malpractice. Somebody practicing outside their scope of medicine, giving misinformation. This woman is very much in the right. She knows what she's talking about, and thankfully, her mother did not listen to Dr. Lake and she got the biopsy.